Hello, everyone. My name is Destiny. I am the media strategist for Seeds of Healing, and I will be facilitating this discussion today. Seeds of Healing is a nonprofit firmly rooted in the Wilmington, North Carolina community. An advocacy and action organization, Seeds of Healing seeks to deconstruct myths that perpetuate fear and stigma and generate sustained support for women with a diagnosis of HIV. This is such an important conversation for everyone, so thank you for joining us. This conversation will be recorded and posted on our YouTube channel later this week. And if we have time at the end of the discussion, I will pull questions from Facebook Live. But if you do not get to your questions, we will answer them later on. I'm going to give a brief introduction of our discussion participants, and then we can get started. So Lepena lives with the belief that healthy living is essential to healthier outcomes. Testing positive for HIV in the late 80s, her primary focus is on prevention and adherence. As a certified health educator, she's committed to advocating for policies that will improve the lives of people living with HIV, to become proactive and self-sufficient in managing their healthcare needs. We have Bonetta, who has been diagnosed with HIV for 30 years. She's been an advocate and a voice for many for 20 years and loves the work she does. Her passion is helping those that are newly diagnosed and their families become knowledgeable of HIV to target stigma and dispel the myths that come with it. We have Dr. Adimora, who is a Sarah Graham Keenan Distinguished Professor of Medicine and Professor of Epidemiology at the University of North Carolina at Chapel Hill. She's an infectious diseases physician at UNC hospitals and has over 25 years of experience in the care of people with HIV. And she is also a member of the NIH COVID guidelines panel. So thank you all so much for participating, and we can get this started.
Good, so I have the first question that I would like to ask in reference to the vaccine for COVID. How will the vaccine affect someone that is on HIV medications or other medications?
Okay, well, thanks for that question, Bonetta. First, why don't I give just a little overview of the vaccine, just so that we're all talking about the same thing. So the virus that we're talking about is SARS-CoV-2 is the name of the virus. The disease that it causes is COVID-19. There are currently 2 vaccines that have been authorized by the FDA for emergency use in the United States. And those are the Pfizer vaccine and the Moderna vaccine. So first, just a little bit about these vaccines. Both of these vaccines are, and I want to say this has been really quite extraordinary and miraculous that vaccines for this disease were developed in such an extraordinarily short time and tested and have been authorized. It's really amazing. And thank God, given the number of people who have not only gotten infection, but who have actually died from this. Both of these vaccines, now the vaccines that are in development use a variety of different methods. There are different types of them. But these 2 vaccines, the Pfizer and the Moderna, are something called mRNA vaccines. mRNA, or messenger RNA, mRNA, is genetic material that gives your body instructions on how to make proteins. So after the mRNA COVID vaccine, whether it's Pfizer or Moderna, is injected into your arm, it gives the cells in your body instructions on how to make the spike protein, that's this thing on the outside of the virus. And when the spike protein is produced in our bodies, it causes our immune system to make antibodies. And these are naturally produced chemicals. Our body makes these chemicals to protect us from COVID-19 if we get exposed to the coronavirus later on. Now, enzymes in the body break down the mRNA, the vaccine, and get rid of it. There's no live virus, or in fact, there's no virus at all, and there's no genetic material getting into your cells. So your question was, how will the vaccine affect someone that's on ARVs or other medications? That's right? That's what your question was? So it's not going to affect them differently. In fact, it's best if people with HIV are on their antiretroviral medications, their ARVs, so that they give their immune system the best chance possible of responding to the vaccine.
Thank you.
Good morning, panelists. So I'm happy to be a part of this conversation this morning. A question that I have is, are there any concerns for those that have had previous opportunistic infections?
So, that's really not known, strictly speaking, but probably not. Both of the studies, the phase 3 studies with Pfizer and Moderna, had people with well-controlled HIV, and they don't appear to have had problems. Now, their HIV was well-controlled at the time they were in the studies, it's my recollection, but it's quite possible that they had had opportunistic infections in the past. I honestly don't know, but I suspect that's the case. The major concern, if a person with HIV has had opportunistic infections, would be, how well it works if your immune system doesn't work well. Because remember, this type of vaccine is trying to get your immune system to produce these antibodies. So the major concern would be how well it would work if your immune system doesn't work well. Not that you would be at increased risk for side effects or other problems due to the vaccine. That hasn't been seen yet.
Thank you.
Okay, so what are the side effects of the vaccine?
So, both of these vaccines are sort of reactogenic, and, meaning that they can cause people to have some side effects, which are typically, they're mild, not super dangerous, but they're due to the fact that the vaccine is working, due to the brisk immune response that the vaccine is causing. And the most common side effect is pain, where at the injection site, especially in the, say, 12 to 24 hours after you get the vaccine. 1% of people in the trial said the pain was severe. The other pretty common side effects are fatigue and headache. Sometimes people have high fevers, but that was actually much less common. And these side effects generally go away within a couple of days, is what the vast majority of people say. And they respond pretty well to things like Tylenol or, ibuprofen. In general, these side effects have been more common in younger people who get the vaccine than in older people. And the second shot usually has been more likely to cause side effects than the first. Those are the main ones.
I have heard that, there's concern, people have asked about the vaccine and how often you would need to get the vaccine. Would it be one time, annually, or every 5 years? Is there a timeline on that?
Yeah, so these two vaccines, Pfizer and Moderna, both have to be given twice. Pfizer, you get one on day 1 and the next one on day 21. Moderna, you get one on day 1 and the next one on day 28. But, it's not known at this point. Remember, this is a new disease. This time last year, we were just seeing the first cases. So it's not known how long the protection will last. The answer to that just isn't known yet. We'll have to see.
Thank you so much. So you may have touched a little on this next question, but what is expected to happen in the body after receiving the vaccine that will protect the person from the actual disease, from COVID?
Right. So as you said, I basically mentioned that, but just to reiterate it, it's basically that the mRNA the mRNA tells your body to make the protein. Once you make the protein, your body makes antibodies, remembering that antibodies are a type of chemical that we make to lots of different things, typically infections. But anyway, these antibodies are among the things that help protect us from the coronavirus if we see the virus in the future.
The previous question that I asked about how long would, how many, times would you need to get vaccinated? But this question kind of bounces back off of it. How long would I have protection against a COVID-19 after being vaccinated?
So, the protection starts in a few weeks, a couple of weeks after you get your first vaccine, and then it's complete with these vaccines. And roughly, I think it's about a couple of weeks after the second dose. The duration, as I said, the duration of protection, unfortunately, is not yet known. I guess that information will be forthcoming, but it really isn't known at this time.
Thanks.
So I think the million-dollar question is, which is everybody's concern, will this vaccine keep you from dying of COVID?
Well, remember, nothing's 100%, okay? But these vaccines are they're remarkably effective, much more effective than was ever anticipated that these initial vaccines would be. And they dramatically decrease the chances that you'll experience severe COVID infection. Both vaccines were about 94 to 95% effective. That's actually fantastic. So they dramatically decrease your chances of getting severe COVID and of dying from it.
And about the two vaccines that are produced by different companies, is there any difference between the vaccines, the Pfizer versus Moderna?
Yeah, I think there's slight differences in the composition, but I mean, they're clearly two different products, although they both work similarly. But there is not any evidence that one is better than the other. And so honestly, I would tell people, whichever one is offered to you that you can get, take it. Because there is not a reason to believe that one of these is better than the other.
Thanks. And so both Pfizer and Moderna vaccines undergo the clinical trials?
Yeah, they both did. Together, these were tested in more than 70,000 people in clinical trials. One had more than 30,000 people in the trial. The other had more than 40,000 people. So they were tested on a lot of people. In addition, I know that people worry about rare side effects because, honestly, 70,000 people is a lot. But it's possible that you can miss things that are, like 1 in a million complications. But as of right now, February 9th, it's my understanding that more than 6 million people in the United States have actually gotten both doses of the vaccine, and considerably more than that have gotten at least one. So we're at the point where we should be able to see fairly rare side effects, these 1 in a million side effects. So the answer is yes. A lot. They definitely both went extensive clinical, well-conducted clinical trials. And we've also had additional opportunities to observe what happens to people when a whole lot of more people have gotten the vaccine. So people don't need to hold back to say, well, let me just add one more thing, Lepena. People don't need to hold back and say, well, I'm going to wait and see what happens to the rest of these people, because a fair number of people have gotten it. Now, I want to emphasize that's nowhere near the number of people who should get it, because there are more than 300 million people in the United States. So 6 million is a small fraction, but in terms of seeing side effects, I think we're well on the way to being able to tell what's going to happen with these.
Thank you. Here is a huge question from so many that once you have received the vaccine, do you still have to wear a mask, frequently wash your hands, and do social distancing?
Yeah, that's a great question, and people want to know that. And I know people, these are great vaccines, but they don't make you bulletproof. And they're not 100% effective. They're very, very effective. 94, 95% is quite effective. But one of the issues is that it's not entirely clear, in addition to that, that they will make it so that you can't get the virus. Because remember, some people get the virus and don't actually get sick. So the additional concern is that you could still get the virus. Not only could you yourself get it and get a mild illness, but it is possible that you could get it and have no symptoms and pass it on to other people. Now, the vaccine probably does decrease that chance, but that has not been well established. In addition, there is I know everybody's been hearing about all these new variants, and as the vaccine mutates, the protection for some of these variants is a little bit less clear. It probably is better, it's almost certainly better than not having been vaccinated, but it doesn't make you bulletproof. So for your own protection and for protection of other people, it is critically important to continue to do things like wearing a mask, washing your hands often, and physically distancing even after you get the vaccine. I hope that was clear. Is that clear, people? Okay.
Yes.
Yeah.
So say
big
someone
concern.
has a compromised immune system, how soon should they get the vaccine?
So, I think the answer to that is, first, it depends. When I saw this question, I wasn't sure. Did you mean compromised by HIV or something else?
I guess either, because not everyone has HIV, but some people's immune system are compromised by other means. So,
well, the general answer to the question is that it is probably better to get it as soon as you can get it, as soon as it's offered to you, is I think, what the best answer to that question is. And that's certainly true for people with HIV, and people with HIV were in the trials. Now, there weren't huge numbers of them in the trials, but they were there. They were in there. So in general, I think the answer is, people with cancer, people with HIV, it's a good idea to get the vaccine when you can. Now, transplant patients and people who are heavily immunocompromised, people who are actively on chemotherapy need to talk about it with their doctors. And again, the issue for the most part is not specifically, is not really so much that the vaccine would hurt them, but you want to time it so that it's most likely to work. But the general answer to the question is, get it when it's offered to you. Talk to your doctor and get it when it's offered to you. And that's certainly true for people with HIV.
And what I think is that people are asking, are these vaccines safe?
Yeah, and that's a great question. Let me say, there's nothing in medicine that's 100% safe, including like even aspirin. Okay, there's nothing that's 100% safe. But having said that, as I said earlier, these vaccines were tested on, each 30 to 40,000 people for each trial. In addition, they've been given to, at least the full doses to more than 6 million people so far. There are certainly always going to be sort of rare things that occur that may or may not even be associated with the vaccine. I mean, things happen to people, in life that's not necessarily even related to, they could be things that occur that have nothing to do with the vaccine. Having said that, most vaccine effects occur during the first few weeks after you get the vaccine. And I think that there's good evidence that yes, these vaccines are safe. And I'll tell you, they're certainly safer than getting COVID. I'll tell you that much. So I think that's the important thing to remember, is that it's certainly safer than getting COVID.
Well, this is a second part to the question that I asked, and this is, if you receive the vaccine, will you still need to continue to test for COVID-19 regularly? And if you have symptoms or if you come in contact with a person who's positive with COVID-19?
So if you have symptoms that are related to COVID-19, even if you get the vaccine, yes, you should get tested. And the reason for that is that, again, although it's 94, 95%, effective, people still can get it. It's just a lot less likely that they'll have severe cases of it. So yes, you should still get tested. Now, I guess the second part of that question was, if you come in contact with a person who's positive for COVID, I would still follow the CDC guidelines about, if you have a significant exposure, that you should still get tested. At least I'm pretty sure that's the current guidance right at this moment. I guess it's possible it will change, but I think the best course of action right now is, if you have a significant exposure, you should do the same thing that you would have done before, which is to, yes, go ahead and get evaluated and tested for COVID.
Good information. So would you recommend medications any medications to be discontinued before receiving the vaccine?
I am not aware of any medications that need to be stopped before taking this vaccine. I think the one thing is that the Centers for Disease Control, the CDC, does recommend that people avoid pre-treating themselves with things like acetaminophen, Tylenol, or non-steroidal anti-inflammatory drugs like Motrin, ibuprofen, Advil. They recommend that you avoid pre-treating yourself with those. Now, if you have symptoms that you can't tolerate, you can, for symptomatic relief after the vaccine, if you actually develop symptoms, you can go ahead and take some Tylenol and Motrin. But they recommend that you don't pre-treat yourself. And the reason is, there's this theoretical concern that it might interfere with the immune response. So don't pre-treat yourself with these anti-inflammatory drugs, is the current recommendation.
This has been a concern for long-term survivors. Many have comorbidities with medications and health concerns like diabetes, lung and heart disease, just to name a few. Would the vaccine cause additional health issues to arise?
So there is no reason to believe that that is the case. No reason at all. In fact, some of those things that you mentioned, things like diabetes, heart disease, chronic lung disease, those are among the things that increase the severity of COVID. So those are the exact reasons why you should get the vaccine. And no, there is no reason to believe, in all the people that have been taken so far, that the vaccine would worsen those problems.
So we have a question here, but I want to switch and ask you. It's just been bubbling. I know that a lot of hospitals have been overrun, and some people have been having to treat themselves at home. What would you suggest for those that have been diagnosed with COVID, but have treated themselves at home?
Well, first of all, I wouldn't recommend just treating yourself at home. I would recommend seeing a healthcare provider, seeing your doctor, or because you want to know how bad your oxygen is, or if you have any other indications, any reasons that you may need to get admitted to the hospital for specific treatments, like the antiviral drug remdesivir or to get dexamethasone. So you need to see your healthcare provider. For those people for whom it's been deemed not necessary to be admitted to the hospital, one thing that it's important to monitor in addition to your fever is your oxygen level, if at all possible. So it would be a good idea. Again, this is something you need to talk to your healthcare provider about the best way to monitor yourself. But one thing that is an intelligent thing to do, if you can get one, is something called a pulse oximeter, so that you can measure you put it on your finger typically, and it can tell how, what your oxygen saturation is in your blood. But the short answer to the question is, you need to see your doctor if you've been diagnosed with COVID so that it can be determined whether or not you need to be admitted for special monitoring and evaluation and to get special treatments. If it turns out that you don't need to be admitted, you can talk with your doctor or your other healthcare provider about what exactly they recommend that you should do. But those are things, among the things you want to look out for, is fever levels, oxygen levels, increased difficulty breathing, these types of things.
Okay.
I just want to say a lot of my concerns and questions have been answered this morning. And I have one final one that I'd like to ask, and it's who should not get vaccinated?
I don't know of anyone who should actually not get vaccinated.
Okay.
I encourage people, particularly if you're older, I encourage Black people that if you are offered this vaccine, you need to get it. We need to get it when it's offered to us.
Sure.
There've been some difficulties with people getting it, and there's been some hesitancy about getting the vaccine, which I understand, but I really want to emphasize these vaccines have been well tested, and the unequivocally true statement is that you are better off getting this vaccine than getting COVID. And there's a lot of COVID in the communities all around. So people are at substantial risk. We already talked about the things that increase your risk for having severe cases: older age, diabetes, heart disease, lung disease, being overweight, having obesity. All of these things increase your risk. The effects of HIV in terms of whether it causes, it's more likely to get it or more likely to have severe disease once you get it, it's not that clear. There's some studies that have said HIV makes it worse, but there's some studies that really haven't shown any difference. One issue is that a lot of people with HIV have these other medical problems, these comorbidities, the diabetes and the overweight and the, cancer, heart disease, things that other people in the general population have. And HIV doesn't seem to protect you from it. So I know of no one who should not get the vaccine. When you're offered it, I think you should take it.
Okay.
Well, thank you so much, everyone, for an incredible discussion and a plethora of information. If anyone has any questions, please feel free to reach out to Seeds of Healing via email or on our social media platforms. And I hope you all have an incredible day and you stay safe.
Stay well. Thank you so much.
Thank you.
Be
My
safe.
pleasure.
Thank you all.
Take care.
You.